Hi, my name is Mike Milligy. I'm a licensed Medicare health insurance broker. I'm also a card-carrying Medicare man myself, so I've gone through the process like you're about going through right now. I've taken care of my own insurance, but I also help everybody else with their Medicare decisions. Today, we're going to talk about Medicare Part A. Medicare Part A is hospital coverage. Okay, so it refers to an admitted hospital stay. You're going to be into a room. It's not the emergency room. That's not covered under A. That's covered under B, which we're going to talk about in another installment. So it's the admitted hospital stay. They're going to pay for a room. It's not going to be a single room. It's going to be a common room. You're going to have a roommate. It's going to pay for nursing services, medications. As a matter of fact, it's going to pay for all services necessary to help in your recovery to leave the hospital. But it doesn't pay for everything. For example, it's not going to pay for a phone or a TV, boring. It's not going to pay for toiletries like toothbrush, toothpaste, even razor blades. Medicare Part A also covers a stay in a skilled nursing facility. Let's assume you're so banged up you can't go home right away, but you're well enough to leave the hospital. You'll go to a skilled nursing facility to help in your rehabilitation so you can transit to home. As a matter of fact, you're going to cover up to 20 days in a skilled nursing facility, which we're going to go over shortly. Now let's get to the cost of Medicare Part A. Medicare does not pay 100% of your hospital stay. You have to come up with some money. So we're going to talk about that too. So Medicare Part A has costs. All right. As far as a monthly premium goes, if you worked more than 10 years and paid into the system through your payroll for more than 10 years, which for the government is 40 quarters, okay, over 10, let's do that, 10 years working, you're going to pay for Medicare Part A monthly nothing, all right? It's going to be free. But if you work less than 10 years, depending upon how much that is, you could pay anywhere from $278 per month to $506 per month. All right? But most people have worked more than 10 years, and that's what they're going to pay. When you use Medicare Part A, all right, if you go in the hospital for one day or up to 60 days, or anywhere in between, you're going to pay a deductible of $1,600. All right? 5 days, 35 days, it's going to be one number. All right? As you can see, the longer you stay, the cheaper it's going to be, but I know most people want to get out of there. If you're in there on day 61, though, through day 90, it's then going to change. It's going to go to $400 per day. Not so much fun, all right? If you're in longer still, on day 91 through day 150, it will then double to $800 per day. Okay, as you can see, it's going to start getting a little bit expensive. If you're in there beyond, what does it say beyond? And you're responsible for all costs. But this is really the one that you would be probably most concerned with, because this most of the time they'll put you to another facility and just clear that hospital room out. So this is the one to think about. Now the 60 days is kind of critical because it's considered a benefit period. What does that mean? It means that if you went into the hospital, say in January for your knee, and you had to go back in February for the same knee and the same thing, well, it's within 60 days. It's within the benefit period, so you wouldn't have to pay again. But if you went in for something else, you would have to pay another $1,600. Obviously, it does make a case for thinking about some sort of Medicare health insurance plan to go with this, because as you can see, as things go along, it can get very, very expensive. Medicare also covers, as I mentioned, skilled nursing facility. This is to help transition home after a hospital stay. Maybe you need some rehab. Maybe you're not able to take care of yourself right away. We're going to talk about that. They do cover a certain amount of time. Skilled nursing facility. All right. What they're going to give you is they're going to give you up to 20 days, right? So it's going to be free. Not going to cost you anything for those 20 days. But on day 21, if you're still there through 100, through day 100, it will cost $200 per day. Okay? If you're still there on day 101, which I'm not sure why you would be, but you never know, and beyond, you're responsible for all costs. So there you have it. Medicare Part A, most people working over 10 years paid into the system through payroll tax and things like that. You're not going to pay monthly for Medicare Part A. You're going to get it for free. If you go in the hospital, and this is the scenario you're probably considering, hospital stays 2-3 days, maybe 5, okay, you're looking at a deductible of $1,600. Obviously, if you have multiple hospital stays through the year, you're going to have multiple 1,600s if it's for different things. Medicare doesn't have any lid that caps you out where they go, look, we'll take it from here. They're going to pay what they're going to pay, and they're going to expect you to pay what expect you to pay what you need to pay. Skilled nursing facility, they're going to give you 20 days. After that, on day 21, you're looking at $200 per day. Any other questions with that? Feel free to send me an email, mmIlinsurance@gmail. My website is mymedicaremike.com. There's other videos in there. There's all kinds of information for you. At the end of the day, give me a call, 631-774-3786. Thank you for watching.